So what we need to do to change the current picture, I think you may already know, it's already been said a couple of times this morning, but we did like the policy that is current at the moment. Yep. We just thought there was a bit of a gap between what was written and the implementation side. So, and we need a few more additions. So making smoke-free conditions for all council grants, leases and licences, and strengthen the implementation. And this is a bit, and I know the policy team really are concerned about this, and big ups to them for this particular issue. They are concerned about Māori smoking rates. That's very clear. Part of the way to deal with that in regards to strengthening the current policy is a good communication strategy. If we do it right for Māori, if we target our communication to our population groups, to Māori population groups and Pacific, we can bring them alongside us. They will know, they will be aware, and they'll be prepared to talk to their own whānau around this issue. That is key. And Melbourne, internationally, communication strategies are what have made bylaws really work. So we can't forget that part of the whole bylaw process. In summary, support options 1 and 3 together, a combination, and just strengthening the conditions for all council grants, leases and licensing, slip that in, and again, I keep saying it, the implementation part. You guys did a really good submission to central government on plain packaging, because in current policy it states that you will write submissions and have a voice nationally. You did that and you did it really well, and we'd like to see that continue, because that speaks volumes nationally. It's kind of set a precedence in regards to other councils. So thank you for your time. I hope that we hear some good things from you in regards to what we have recommended and other people in the audience have recommended. Well done to everybody for the current policy and the policy team for working so hard on this issue. Kia ora.
Thank you. Any questions?
Any questions?
Councillor Casey.
Hapai wants us to do a bit more work with regard to grants, leases and licences. Did you mean events as well?
Events as well, absolutely. You guys have the power to do that, and it would be great to see it happen.
Thank you.
Oh, actually,
Councillor Wayne Walker.
Sure. One of the issues that I raised on a previous occasion around Smokefree is the problem in apartment space and effectively body corporate space. Mm. Would it be possible to have some suggested wording for body corporates and the like, so that they've got something that they can pick up and run with?
Actually,
and I mention this because this is developing as a serious problem as we've got more people in apartment space and shared spaces, and many of those shared spaces increasingly are controlled by body corporates.
It's an interesting point you bring up, and actually one that I have been working with some of our colleagues in Australia on. So they're moving to that space, and we need to move into that space too. And absolutely, we're looking at wording and we're looking at how they've been doing, because it's working quite well. And we're about to progress some of that work here in New Zealand, and we'd love to work with you more on that.
And if I can just speak further to that, it would be really good if there was some point of engagement with council officers around this, because I think that council has a very real role. Obviously we can't tell body corporates what to do, but if we can put the information on the table so that they can pick it up more easily as it applies to a number of things, that's important.
Yeah, absolutely, yep. And actually we're starting to build those relationships with some of those people right now.
Councillor Cashmore.
Thanks, Mr. Chairman. What does targeted communication to Māori and Pacifica look like? If you have examples that actually have worked?
I think at the moment our current smoke-free signage it had its place. Now we need to move to a different sort of messaging where we include Māori language. There's some specific messages that are really relevant to our communities, and if you get the right people working with people like Hapai and other Māori organisations, I think you can easily secure messages that are really going to work.
So anything else other than signage?
I think there's a whole stream of communication strategies. No, it should not just be left to signage. That's part of the process. But talking to communities, consulting with communities, even some media, radio, I know the radio station, I think we all do, that Māori will listen to in those communities, and we can target those avenues, those media outlets that will speak to those communities.
Thank you.
Councillor Quacks.
Oh, thank you, Mr. Chairman. Zoe, it's probably reasonable to assume that if you can stop people from taking up smoking in the first place, that would be very helpful, because it is very addictive, as we know, and hard to give up.
Absolutely.
So why is it that, from your experience, that Maoris still seem to be taking up smoking at such a high rate, double the rate of the rest of the population? Why would that be?
Oh, there's a number of factors, and bylaws are just one of the key strategies that we need in place to ensure that Māori don't continue to pick smoking up. There's other things that are going on. You know, when you think about tobacco, it's sold at our dairies, it's by the bread and the butter and the lollies. It is absolutely incredibly normalised, and for our communities, Māori communities especially, when you look at the numbers of outlets in the communities that we live, it's actually more than other places. Again, we have a historical smoking experience that is embedded, strongly embedded in generations after generation of our people. Now it's moving a little because of all the strategies put in place, more to go, and lowering the number of outlets, making the supply less, are all part of the big picture strategies that need to combine together to get us to a place where we aren't continuing to smoke. I do recall, somebody said a really great quote, Ben Yoden, who was the previous CEO of Ash in regards to tobacco, and he said the only choice people have in regards to smoking is taking it up. After that, it's not a choice because you're addicted.
Thank you. Well, thank you, Zoe.
George,
Oh, sorry, Arthur. Councillor Nye.
thank you. Look, I've raised this thing before, and I'll say it again, because I think it needs to be chased up, and probably your team can do it. Early 50s, right behind us here was Chinatown, boarding house establishments all up here. They were opium smokers, the old people. And what they did, they made it a prescription drug. The only way the old people could get it was by prescription. If that type of thinking was applied to tobacco, we may make some progress.
It's certainly something that a lot of our researchers at Otago and University talk to. And there's some, right now there's a consultation process around e-cigarettes with nicotine in, so that's for some a possible solution in regards to weaning people off the product that actually is killing us, which is tobacco.
And I'll raise what I said to you because opium disappeared altogether at the end of that program. Thank you.
Kia ora.
Councillor Cooper.
Thank you for your presentation. For me, the elephant in the room is the economic inequalities that it causes, and I don't hear anything. No one ever seems to talk about that. And I do take issue with you having been a practice nurse and supported people through giving up. You can give up, it is a choice.
Yep.
However, I'm wondering whether in your programs you're actually really going hard out on this stuff, because we talk about the health effects, absolutely, and I completely agree with you. However, there's the economic effects, which are absolutely equally devastating to low-income families, equally devastating, and which take the food out of children's mouths. And so do you actually go there? Because that's seems to be what worked in our practice when people realised what they were doing or taking away from their children was often the trigger. It wasn't about them. It's the same as family violence. They look at it and they go, oh my God, I've put up with it, but look what it's doing to my children. And I'm just wondering, you know, we talk about all this, but, you know,
Yeah, Councillor Cooper.
organisation really going there?
Yeah, you bring up some really good points. I myself am an ex-smoker. When I was on the shore, George Rort.
Very permissive
You might
there.
have seen me smoking a few times.
Get out of it.
And I did make the choice to give up, but certainly there were some key things that helped me around giving up. And one of the things was the BP station up the road. I moved away from, so I couldn't get there easily to buy cigarettes. So there was definitely for me, I wanted to give up, but I needed the environmental support around me to make it happen.
Yeah.
So I think it's a combo. It's not one or the other, it's both.
That's right.
And your power here is to put the environmental stuff in place. There are a whole lot of new stop smoking services that are about to start to help with the other part of the picture. And the ministry have realigned our stop smoking services to ensure they're going to be more accessible, out there promoting themselves and working really effectively with people, with those messages around cost, around the economic benefits of stopping. So they are definitely all part of the parcel.
Yeah,
but I
absolutely.
guess
It's
here, it's something different that we're looking at from you, which is the environment. Kia ora.
I was just going to move, Mr Chairman,
Yeah,
the
that's fine,
thanks.
okay.
And I was going to suggest that maybe in addition to thanking Zoe for attendance, we should thank her for moving from the North Shore.
I do love Orake.
I'll second that. I'll put the motion. Those in favour? Aye. Against? Okay,
Kia
declare
ora.
that carried. Thank you, Zoe.
Thank
Much
you for your time.
appreciated. Thank you. And our last presentation and public input is Dr. David Sinclair, Medical Officer of Health.
Good morning, councillors. I'm David Sinclair. I'm one of the medical officers of health with the Public Health Service of Auckland Regional Public Health, and I have apologies from Dr. Brad Novak, who would normally be here, and I have with me Dean Adam, who's the manager of our health improvement team, who handle our Smokefree program. Just from listening to the discussion so far this morning, very encouraged by the level of discussion and engagement with Council. We're very supportive of the policy that Council has had over the last few years and its development. And we see this as a really quite important area where many organisations and agencies are involved with trying to make some good progress. We're also encouraged by the way that the Auckland Plan has been facilitated some of that interaction and discussion over the last few years. As you know, we are one of the regulatory agencies for dealing with the Smoke-Free Environments Act, and a lot of our work involves some of the issues you're talking about here today, about the way that regulation gets enforced and administered, that sort of balance between education and support and the hard end. So I think it's an important discussion. We certainly would agree with the previous presenters around the importance of working on this, the option and the details around what will be in a potential bylaw, as well as continuing on with the policy. I'm going to hand over to Dean, who's got our presentation and most of our details. So thank you very much for your invitation to come here.
Thank you, David. Kia ora tātou. Thank you for the opportunity to talk to you. As David, Dr. Sinclair mentioned, our Smoke-Free program covers policy advice implementation, compliance, until recently cessation support. So we do feel we've got a good understanding of some of the complexities that councillors have been interested in today. As Council's existing policy recognises, and other speakers have mentioned, smoking is the leading cause of mortality in New Zealand. It's one of the main contributors to disparities of health outcomes and life expectancy for Māori and Pacific communities in our country. Your current policy supports collective responsibility towards smoke-free tamaki makaurau, and we are working closely with council staff and other sector stakeholders to identify actions that we can do to advance this goal. And we do want to recognise and appreciate that partnership today, but also we have some thoughts around some active and practical ways council could also take this forward. The key point we wanted to make with you is that while we agree with the importance of strengthening the implementation of the current policy, we also believe that option 3, the investigation of a targeted bylaw, is a necessary requirement to complement any improvements or revisions. Investigating a targeted bylaw will be a significant opportunity to start creating an integrated system that aligns public policy, regulatory and enforcement mechanisms for tobacco control in Auckland. And 3 points we wanted to make to support that view. Introduction of a targeted bylaw such as we've proposed would be a significant intervention, landmark policy step for tobacco control, and there's significant value in that in itself. There's several things that council can do now with its existing policy or even through revisions, but these would also be strengthened through the addition of a targeted bylaw. A bylaw such as we're proposing would also help regulatory partners such as ourselves and the rest of the sector towards the goal of a smoke-free Auckland. On the first of these points, the development and socialisation of a targeted bylaw is an effective intervention itself for Auckland that no other agency is able to lead. We believe this represents a critical role for local government in tobacco control and an opportunity for Auckland Council to demonstrate leadership in a significant social and health issue.